Thank you for joining us for the Widow Care video series. Dr. Yuri Deychak joins me today to discuss a topic of great importance to many widows and widowers, which is cardiomyopathy. Dr. Deychak, tell us what that is.
Cardiomyopathy is basically just a term that means the heart isn't working right, the heart muscle in particular. Other names for this condition include takotsubo, which is the Japanese term for an octopus trap because the heart looks like a Japanese octopus trap. It is also called apical ballooning, which means that the tip of the heart just sags there and it looks like a balloon. And finally, the broken heart syndrome, which is more poetic. Learning of the death of a loved one or your spouse is one of the known triggers, but basically with an emotional or even physical stressor, the heart is temporarily broke.
Now, this is an occurrence especially for someone who's been married for many years, truly loved their spouse, and the death of the spouse just causes this impact. What is the actual impact on the heart?
The theory of how this occurs is that when a stressful event occurs, such as the news of the death of the loved one or something unusually physical or some catastrophe, the parts of the brain that deal with stress send hormonal input to the nerve endings of parts of the heart, where we get an overload of catecholamines, like an adrenaline-like compound and a compound called neuropeptide Y, and it just dumps those chemicals right past the nerve endings where the heart is, and it stuns the heart muscle, and it also impedes the microvessel. And what happens is the heart then becomes very weak. That a big part of the heart muscle does not contract.
Broken heart syndrome occurs also for parents sometimes if they have a loved one who's been maybe killed at war or the sudden loss of a child or otherwise. It's the same effect.
It's the same effect regardless of what the emotional stressor is. My last patient in the office today was a widow. She had been a widow for several years, but when she learned of the death of her mother this past December, it happened to her. And she developed the classic types of symptoms that we see.
What are those symptoms?
So those symptoms, the most common symptom is pain or discomfort in the chest or in the upper body. The second most common symptom is shortness of breath. And then thirdly, a feeling of weakness, loss of consciousness, lightheadedness, and dizziness. And sometimes feelings of your heart beating irregularly as well. So all of these things are quite similar, if not identical, to the presentation with a classic heart attack. But this is different than a classic heart attack.
So tachycardia syndrome would be just the irregular heartbeat. So this is one of the effects of the broken heart syndrome? The
broken heart syndrome can have rhythm disturbances too that usually are fast rhythms. That's what we call them, tachycardia. But it happens in a small percentage of people who suffer this. But sometimes these rhythm disturbances can be lethal and need a defibrillator to reverse. So, but primarily it's because the heart isn't pumping well, you get fluid backed up in the lungs so you can't breathe. You feel tired because blood isn't pumping forward. And you get lightheaded or dizzy also because there's not enough blood flowing to the brain, and you can faint or collapse as well.
So in my real estate career, I've worked with many widows and widowers, and recently one of my clients hired me to sell his house after his wife had passed, and they'd been married some 60 years, and he made a move, and he moved into a community where he lived for approximately a month, and then he passed. And according to the family, I think it was the broken heart syndrome that took him. And similarly, another couple that I worked with a couple of years ago, within a month of the husband dying, the wife died. And so what are the preventative measures that someone who may be facing widowhood or may have just experienced widowhood, what kinds of things can they do to protect themselves in that situation?
Well, the reality is we don't have any data that there is an intervention that you can prevent this effect. For a classic heart attack, there are medications that can be administered to reduce the risk. However, it is very well known about the widowhood effect that the surviving spouse has a higher likelihood of passing. Why is that? It can be the emotional stress. In other cases, depression can set in. The individual may withdraw from family and friends, may decide that life isn't worth living after the loss of a loved one and stop taking their medications as prescribed. So I think those are all different components of what happens when people are widowed. I know it from my mother too. When we lost our dad, it was, and 10 years later, it still is very difficult.
Widow Care is here to help widows and widowers to connect so that there isn't that social isolation. Oftentimes it can lead to job loss, it can lead to just a spiraling, and then it's very difficult to come back out of that. So we really appreciate your coming in to explain how broken heart syndrome works and how Widow Care can potentially help those who are watching today. And if you're interested, you go to widowcare.org for more information. Doctor, is there anything else you'd like to add about the syndrome or anything else?
Yes, the syndrome itself is different than a classic heart attack. Most of our patients, we have to exclude that an artery blocked off in the heart, and they end up having normal heart arteries. And the good news about this condition is that in almost every case, the heart returns to normal within a month, with the exception of 5% where the outcome can be bad. It's very important to be attentive to your symptoms and not to ignore them. If you feel these kinds of symptoms, that is chest discomfort, shortness of breath, weakness, lightheadedness, do not delay coming to the emergency room. Call 911. That's the best way to get to the emergency room if you're having a heart problem. Because once we recognize the broken heart syndrome, in most cases, the broken heart will unbreak itself, with very few exceptions. But we need to differentiate that from other causes of the symptoms. So do not ignore the symptoms and take action.
Thank you, Doctor. Perhaps you're a part of a group of widows or widowers outside of our immediate area. Perhaps you'd like to share your information with other widows so they can find you and find support during your time of loss. We would love to promote your group at widowcare.org, and we're about supporting all widow groups and all widows and widowers everywhere with the best content and information, as well as guidance as Dr. Deychak has provided for us today. We're so grateful that you joined us. Thank you for joining us, and I wish you well. I'm Eric Stewart for Widow Care. Thank you for joining us.